The calcium we consume binds with oxalates in the intestines, thus reducing absorption into the bloodstream. So in my practice, I do not tell my patients to go on a low calcium diet. There is no evidence to show that cranberry has a beneficial effect in kidney stone patients in terms of reducing incidence or recurrence.
Beer's got a lot of fluid in it, and that won't do you any harm in passing a kidney stone. And having a kidney stone is a painful thing, and beer will probably make you feel a bit happier. But in terms of definitively managing the pain and obstruction with a kidney stone, beer probably won't do any good. If you've got significant troubles from kidney stones, that's when you probably need appropriate imaging and treatment accordingly. People say that having a soda or two will give rise to a kidney stone, but in fact the opposite is true. Provided you're having the fluid intake that comes with the soda, and in particular if the soda is not high in sugar content, the soda will probably do very little in terms of promoting a kidney stone, and in fact may flush out the small components and crystals of kidney stones at their earliest point.
The truth is that not all kidney stones require medical procedures or surgical treatment. Patients with small asymptomatic stones, which are not causing obstruction or other complications, may be treated conservatively by observation and do not need active treatment. Depending on the size, location, and whether or not there is obstruction caused by the stones, the patient may or may not have symptoms. So in general, kidney stone patients may be totally asymptomatic, or they may have symptoms such as pain, hematuria, which is blood in the urine, or they may even have infection that can cause fever. Okay.
It's hard to think that all tea would be bad for anything, but all tea is probably not bad for kidney stones. And it's going to be fine to have a balanced diet in terms of food intake and fluid intake, and that includes tea. Kidney stones are a very broad range of pathologies. And whilst there are some kidney stones that are clearly related to dietary abnormalities and can be affected by that, for the sake of example, uric acid stones, the majority of kidney stones, which are calcium related, probably have a very different dietary origin, if at all, any dietary origin, other than for people taking large amounts of calcium and supplementation. So adjusting your diet to fix the kidney stones is probably not going to be that valuable unless you know exactly what kidney stone type you're getting. And so this will be a very different and a very subtle thing between all people with kidney stones. Adjusting to remove one type of food may not improve your kidney stone.